So the question is now, if you want butt implant on your butt, what is the new way to do it then? So so basically, well, first thing I'd say is I'm not an expert in butts. I'm not a buttock expert. And if you do want your butt, there's not a nice way to say it really, is there? Bottom operated on, you probably, well, not probably, you are better seeing an expert. So I'm not really a man if you want your butt done, but nevertheless, I can certainly talk about butts and the best way to do butts. So we start basically the history was we started with implants. So buttock implants, gluteal implants, to be medical about it. And we put implants in the buttocks to enhance the buttocks. And there was a lot of problems with implants. The implants were, because it's obviously you're sitting on it all the time, they could migrate, they could move. There's people will often worry about where to put it in the breast. When you put implants, you put them in front of or behind the muscle. There's a sort of similar way of doing it in the buttock, where it would become intramuscular or submuscular. Intramuscular is quite bloody because you put it sort of within the muscle. Submuscular, people would worry because there's a sciatic nerve there, which is a massive nerve which supplies your leg, and you don't want to damage that nerve because you need to be able to walk. So if you've got so there was problems with the surgery. It's difficult surgery, potentially bloody. You get hematomas, you get infection. If you get an infection with the implant, you have to remove the implant. So you've got problems, potential with seromas. So it was fraught with difficulties, movement of the implants. So it was always a bit, one of those operations which was really a niche operation for only a few people who really embraced it. And then the natural history went. Then fat grafting became common in other types of plastic surgery, and fat grafting was really embraced by buttock implant people. Brazilian butt lift, BBL, all this sort of thing. Kim Kardashian, big butts, big bottoms or derrieres or whatever, and that really sort of took off, and the fat grafting for the buttocks really took off and superseded implants. But then what happened was fat grafting. One of the things I always say to patients when I'm doing fat grafting personally, because I do a lot of fat grafting, but I never did fat grafting to the buttock because it was a different thing. When I do fat grafting to the breast, do very small volumes, putting very small aliquots of fat in, because each piece of fat has to be surrounded by vascularized tissue, and you've got to just put a tiny little injections of fat in so that it takes and it doesn't it gets a blood supply. People who are doing buttocks were putting large volume of fat transfer, significantly more volume fat transfers than we were doing in other parts of the body. And I've seen people talk, and I've seen people with great results doing this. And you think, crumbs, how are they managing that? Is that a huge volume of fat transfer? If we could do that at the breast, we'd be away. We wouldn't have to use implants anymore because we could just do fat transfer. Because on paper, fat transfer is better than a million times better than implants. You don't have to no foreign body, no worries about the future in terms of infection or problems like that, or capsular contracture. So on paper, you thought this is great. Don't we often? This is hallelujah. But then what happened? Because there's a lot of big blood vessels around the buttocks, because there's huge muscles. They're called gluteal implants. The gluteal muscles, gluteus maximus, gluteus minimus, gluteus medius, they're huge muscles around your buttocks. If you look at a sort of anatomy specimen of a human, they're very, very big, strong muscles. Your buttock muscles are big, strong muscles, and they've got big blood vessels supplying them. And if you accidentally or inadvertently inject the fat into a blood vessel, then you get what's called an embolus. And an embolus is where tissue moves and gets into a blood vessel, and it can be fat or air or tissue that's not blood, basically. And that can fly around your body, and it basically gets stuck in your lungs, because your lungs, the blood vessels get very small where they sort of pick up oxygen. And if it gets stuck in your lungs, that's called a pulmonary embolus. And that, or in this case, a fat embolus, and that can be fatal. And people have died. Quite a lot of people have died having fat grafting to the buttocks because of this reason. There's a lot of big vessels, inadvertent injection of fat, sort of big glob of fat into a blood vessel, into a big blood vessel, flies around the body, gets stuck in your lungs, and that will kill you. So it had a very high fatality rate, higher than any other type of cosmetic surgery, sort of legions away from any other sort of cosmetic surgery. And so recently it's fallen into sort of fallen out of favor, as you might imagine. Now, some surgeons are a bit annoyed at this because they're saying I'm doing it very safely and I've got a very safe way of doing it, and I make sure I don't get it into big blood vessels and things. As I say, it's nothing I've ever really done, so I can't really get into the conversation there whether that was a good decision or a bad decision. But I haven't told you what the decision is. Well, basically, BARPS, the Plastic Surgery Association in this country, said we shouldn't be doing fat grafting to the buttocks. They said if you're a BARPS plastic surgeon, you should not be doing this surgery until we've gone into it and looked into it and are happy that it's a safe procedure to do. So fat grafting for the buttocks is, is I won't say outlawed, but fully trained BARPS plastic surgeons have been advised not to do it. As I say, I haven't really got into the argument whether that's a fair argument or not, but on the face of it, when you look at the mortality associated with it, you can understand why they did it. And I do know surgeons who used to do it who are a bit annoyed. I don't know whether they can justify that their technique was much safer than the technique that the people who did it, who had the fatalities. But so now we're going back to implants because fat grafting is out. So we're going back full circle to the implants that we went away from because we said they get infected and they move and they can be uncomfortable and all the problems that we had associated with implants. We thought they were really bad. But now some people, and there are people out there, to be honest, not really much in the UK. It's not really big in the UK, but in other countries, certainly in America, in Brazil, in France, there's some very good surgeons who are getting good results with implants and saying that it's a safe procedure and it's good and we should all be doing it, and it's it's the same as breast implants and we should be doing it. Not the same as breast implants, but it's a sort of similar concept and we should all be embracing it and we should be doing more often. I've not really picked it up, to be honest, because it's not an area I'm familiar with. It is an area where there's a lot of very important structures, as I say, the sciatic nerve being probably the most notable one, which is the main nerve that supplies your the leg, the function of your leg. So, but the answer so what was the question? Now, if you want butt implants on your butt, what's the new way to do it? So I guess that's the new way to do it, but in fact, it's the old way to do it, which was superseded by fat transfer. But now fat transfer has gone out, so implants are back in. So short answer, it's implants. No, the question says if you want butt implant. Well, if you want butt implant, it's using a silicone implant rather than a fat, I guess, implant. So yeah, implants are, I guess, the new way of doing it, but you need to find someone who's does a lot of it, is experienced in it, which is not me. And that is what is the new way to do it, my friend. So that is it. Implants are back.